And we continue with aseptic meningitis. Aseptic means not bacterial, means viral meningitis. Caused by viruses, usually it caused by the same viruses that cause upper respiratory tract infections, for example, enteroviruses, arboviruses, and usually this type of viruses affect young children and adults, young adults. Viral meningitis is not as life-threatening as, for example, bacterial meningitis. And usually patients develop symptoms of viral meningitis after they get infected with viruses and develop symptoms of respiratory tract infection. So basically, viral meningitis, it is a complication of upper respiratory tract infection. The symptoms of viral meningitis are not as severe as bacterial meningitis. Symptoms of bacterial meningitis, the main symptoms will be fever, not very severe headaches, muscle aches, symptoms of intoxication. Usually patients do not develop stiff neck symptom in this case. Since viral meningitis is caused by viruses, there's no specific treatment. Actually this is not a big problem because, as I said, viral meningitis is not life-threatening infection, and those patients usually recover within 3, maximum 4 weeks. But you have to remember, if you have a patient and you think that your patient has viral meningitis, you have to be sure in your diagnosis for 100%. Because if patient has bacterial meningitis, that can be a life-threatening condition and requires immediate antibacterial treatment. Next one is fungal meningitis, and as an example, we're going to talk about cryptococcal meningitis. And it's caused by fungus named Cryptococcus neoformans. It is a yeast with thick capsule. The source of infection will be birds and bird droppings, infected birds and bird droppings. Also, it can be found in the soil. People usually get infected when they inhale this fungus. So, what are the symptoms of fungal meningitis? The headaches, confusion, weakness, loss of coordination, and those patients sometimes will develop stiff neck symptom. Once again, this symptom is not very specific for patients with fungal meningitis. But what is the other difference between fungal and bacterial meningitis? Guys, please remember, bacterial meningitis usually has a rapid onset. Fungal meningitis has gradual onset and progresses slowly. Fungal meningitis is not as aggressive, is not as life-threatening as bacterial meningitis. But here I'm talking about, right now I'm talking about healthy individuals with a strong immune system. Of course, for immunocompromised patients, for example, patients with AIDS, fungal meningitis is a life-threatening condition. For the treatment of this type of meningitis of those patients, we're going to use amphotericin B, antifungal drug that we use to treat systemic fungal infections. This drug can produce a lot of nasty side effects, for example, chills, fever, loss of hearing, but without treatment, those patients have 90% mortality rate. And as you see from this slide, in the bottom of the slide says even with the best treatment with amphotericin B, there's still mortality rate for this infection 40% for immunocompromised patients. We move to the next group of infections, and next we're going to talk about infections, and the causative agent for those infections will be toxin. To be more specific, we call it neurotoxin because it affects a nervous system. We start with tetanus. Tetanus is caused by Clostridium tetani. which is a gram-positive bacillus. Actually, under microscope, those bacilli look like drumsticks. Remember I told you all Clostridium species have the same 4 characteristics. So once again, they are all gram-positive bacilli. They are all anaerobes. Next characteristic, they can form endospores. And the last characteristic, they all produce a toxin, and if infection is caused by Clostridium species, the causative agent for those infections is always toxin. In this case is neurotoxin. So the name of that toxin is tetanospasmin. Tetanospasmin. It is very powerful, very strong and deadly neurotoxin. And usually, normally, the central nervous system sends out 2 kinds of messages to muscles. One kind of messages stimulates contraction, the other inhibits it. So tetanospasmin inhibits inhibitory messages to the muscles. As a result, muscles contract but have no ability to relax. As a result, patients will develop a very powerful contraction. Contraction can be so severe, it can break bones. And one of the specific symptoms also will be lockjaw. What will be the source of this infection? The source of infection will be soil. Remember, soil is a source of Clostridium species. People usually get infected through contaminated wounds or non-sterile surgical procedures. Infection is deadly, and usually those patients die from respiratory distress. What does it mean? You probably remember from anatomy class that a diaphragm is muscle. So when tetanospasmin affects diaphragm and diaphragm gets paralyzed, then patients lose ability to breathe and die from respiratory distress. Treatment. Treatment of tetanus must be started before symptoms appeared. For the treatment, we're going to use antitoxin. Unfortunately, after patients develop symptoms of tetanus, there are no specific treatments, and for those patients, we only can offer supportive or symptomatic treatment. Vaccine is available. It is of course toxoid type of vaccine, and immunity usually lasts for about 5, maximum 10 years. Next infection is botulism. Once again, the causative agent of botulism is a neurotoxin, which is produced by Clostridium botulinum. Another example of Clostridium species means it is gram-positive bacillus. It is anaerobe. It can form endospores and can be found in the soil in this form, and also has ability to produce toxin. And once again, because it impacts our nervous system, we call it neurotoxin. So what would be the source of this infection? The source will be a seafood product, the soil, and with the soil, those endospores can be found on certain vegetables, and honey. So what is the pathogenesis of this infection? As I said, a causative agent of this infection is a neurotoxin that is produced by Clostridium botulinum. And what it does, it actually blocks release of acetylcholine, and as a result, impulses will not be transmitted, and patients develop limp or flaccid paralysis. Botulism is considered to be a food poisoning because people usually get infected when they eat food or products containing the neurotoxin that produced by Clostridium botulinum. What would be the source of Clostridium botulinum in those products. Usually those are canned foods or products, especially homemade canned products. When people canned vegetables at home and do not add enough of vinegar to create a low pH, and please remember a low pH or acidic environment inhibits growth of Clostridium botulinum. So when people can, for example, beans, bell peppers, um, cucumbers, mushrooms, those vegetables don't have natural acidity in them, so they require a lot of vinegar to be added. If vinegar is not added, then some endospores can be found on the surface of those products or those vegetables. In anaerobic environment of can, they will start growing, produce toxins, and patient when they eat those products will get infected. The first symptoms actually affect the head of infected individual. So everything starts with the blurred vision. Then patients will have impaired speech. They will develop difficulties swallowing, chewing, and then slowly that flaccid paralysis will spread downwards. And you see a mortality rate is pretty high, 35%, and the cause of death in those patients will be again respiratory distress. Means when that paralysis reaches diaphragm, patients lose ability to breathe and die from respiratory distress. Clostridium botulinum can produce different types of toxins, and the most potent or the strongest one is type A. You have to know two types of botulism. This classification is based on age of the patients. Botulism can be divided into two groups: infant botulism and adult botulism. I already told you that adult botulism is a kind of food poisoning, and people usually get infected when they eat homemade canned products, vegetables, green beans, peppers, mushrooms, cucumbers. Another type of botulism is called infant botulism. You probably remember that we cannot give honey to infants under 6 months old because honey might develop endospores of Clostridium botulinum. As a result, those infants can get infected and develop symptoms of botulism.